What is radiation? Radiation is energy that moves from one phase to another in a form that can be described as wave or particle. There are two types of radiation. The first one is ionizing radiation. This type of radiation has enough energy to remove slightly bound electrons from atoms, leading to the formation of ions. Examples include X-rays and gamma rays. Next, non-ionizing radiation. This type of radiation has lower energy and does not have enough power to remove electrons from atoms. Examples include radio waves, microwave, and invisible light.
The objective of our survey is to show how we can decrease radiation exposure to the patients during the usage of the imaging machines. The second one is to identify how radiation exposure is harmful to the patient in the imaging world. And the last one is to increase the knowledge of the patients about how radiation exposure is work.
In this part, I will explain how ionizing radiation works in X-ray, CT scan, and nuclear medicine. In X-ray imaging, X-rays are directed toward the body, and a detector on the opposite side captures the attenuated X-rays. Common uses of X-ray imaging include detecting fractures, assessing the condition of the lung, and visualizing the skeletal muscle. For CT scan, detector rotate around the patient, capturing multiple images from different angles to create cross-sectional pictures inside selected areas of the body from different angles. The image can show internal organs, blood vessels, soft tissue, and bones. For nuclear medicine, radiopharmaceuticals are introduced into the body, and their distribution is tracked to see how organs or tissue are functioning, to target and destroy damaged or diseased organs or tissue. Ionizing exposure affects the patient. Radiation damage to tissue or organs depends on the dose of radiation received or the absorbed dose, which is expressed in a unit called Legree. There are two types of effect caused by ionizing exposure. At a higher dose, ionizing radiation can cause deterministic effects, which have a threshold below the effects do not occur. Deterministic effect can cause tissue damage, cellular damage, and acute radiation syndrome, or known as ARS. Stochastic effects are random and do not have a threshold level. Stochastic effects can cause cancer risk and hereditary effects. For better understanding, you can read the explanation in the slide. This is the statistic for clinical status of radiation therapy in Korea in 2009 and 2013.
Let's talk about the definition of radiation exposure. Radiation exposure refers to the amount of ionizing radiation that an object or a living organism encounters or absorbs. Ionizing radiation is a form of energy that has enough force to remove tightly bound electrons from an atom to create anions. Common medical imaging machines that produce high radiation exposure, CT scanners. CT scans offer detailed cross-sectional view of the body, making them available for diagnosis. While advancements have reduced radiation doses, CT scans expose patients to higher level compared to some other imaging techniques. Secondly, we have nuclear medicine imaging. Nuclear machines use tiny radioactive tracers to see how organs work. Though safer than older methods, some nuclear medicine tests expose patients to more radiation than routine imaging. And the third one, we have interventional radiography procedures. Interventional radiography involves the use of X-ray for guidance during the certain medical procedures, such as angioplasty, stent placement, or catheterizations. The real-time nature of these procedures may result in increased radiation exposure for both patient and healthcare providers. And fourth, we have fluoroscopy. Fluoroscopy uses continuous X-ray to show real-time images inside the body, helping guide medical procedures like biopsies and cataracts. Radiation exposure depends on procedure's length, with the 30 minutes procedures delivering roughly 10 millis SV, equivalent to 10 chest X-ray. And lastly, we have BET scans. BET positron emission tomography scans use a small amount of radioactive material to highlight area of a body with the abnormal cells activity. While BET scans contribute to clinical diagnosis and staging, they involve the use of ionizing radiation. Type of radiation material that commonly used in that machine. We have X-ray machines, X-ray tubes, electricity powers electrons from cathode to anode hitting a metal target to create X-ray. X-ray filters remove unwanted radiation from the beam, reducing patient dose. Secondly, we have CT scanners. X-ray tubes. CT scanners use the same type of X-ray tubes as a conventional X-ray machine. We have also X-ray detectors convert X-ray to data, creating a 3D image of the body. Third, we have BET scanners. Cyclotrons make a radioactive tracers for BET scans, revealing the tissue activity. Centrollers deduct radioactive tracers radiation, sending info to computer for tissue imaging. Fourthly, we have the nuclear medicine imaging, radioactive tracers, molecules tagged with isotopes to target specific organ for the imaging. Gamma cameras detect reaction from a tracer, then create an image on a computer. Lastly, we have fluoroscopy, X-ray tubes. Fluoroscopy machine use the same tube of X-rays tubes as a conventional X-ray machine. Image intensifier. This device converts X-ray into a visible light using a series of internal components.
Now we will talk about effect of the radiation to the patient. We have here 2 points. The first one, acute radiation syndrome. The second one is skin burn. For acute radiation syndrome, that's occur within hours or day after exposure to high dose. And here we have some symptoms that's appear for the person that's affected by the radiation. The second one is skin burn. The radiation can be burn the skin, similar to sunburn, but often more severe and slow to heal. Now we will move to steps to decrease the radiation exposure. Here we have 4 steps. The first one is time. We need to minimize the time spent near to the radiation. The second one is the distance. We need to increase the distance, maintain a safe from the radiation device. The third one is shielding. We need to use protective barriers such as lead or any other appropriate barriers to block or reduce the perception of the radiation. The last one is follow safety guidelines. By following the safety guideline protocols, unites protective equipment, and a lot of things need to follow it for the safety guideline. Radioactive waste management, we have here 4 points. The first one is characterization and classification. When we talk about characterization, we mean by identifying the type of the properties of the radioactive waste. For the classification, by categorizing the waste based on the level of the radioactivity and half-life. We move to the next point, which is treatment and conditioning. For treatment, by reducing the volume and radioactivity of the waste through some process. For the conditioning, by packaging the treated waste in durable containers that can withstand radiation. The third point for radioactive waste management is decommissioning and monitoring. Decommissioning, we mean that cleaning up the facilities where the radioactive materials were used or stored. For the monitoring, we need to continuously monitoring the storage facilities and surrounding environment. The last point is storage and disposal. Internal storage by placing the packaged waste in secure monitored facilities until the permanent disposal solution is available. For deep geological disposal, consider the most secure long-term solution for high-level radioactive waste.
So for the data analysis, we have conducted an interview with Puan Jie, who works as a physics science officer at the Queen Elizabeth II Hospital in Sabah. This interview was done using WhatsApp app. She was really helpful and cooperative to us during the interview. And also in this interview, we realized that many of the information given by Puan Jie is actually related with the data we acquired by ourselves. Her answers were specific to CT scan, but it still relates to most of our data. She also recommended new ways to reduce the radiation exposure towards the patient. So the following five questions and the answers are given by Puan J during the interview. So the first question asked was, what imaging modalities do you have the most expertise in? And she answered CT scan machine because that is the main machine they specialize in their work field. So the second question is radiation exposure harmful towards the patient, and how does it occur during the patient's treatment process? She's answered, beyond certain thresholds, radiation can impair the functioning of tissues and also organs, and can produce acute effects such as skin redness, hair loss, radiation burns, or acute radiation syndrome. These effects are more severe at higher doses and higher dose rates. However, in medical exposure, applying a dose limit is inappropriate as it may limit the benefit for the patient. Consequently, only two of the radiation protection principles apply, which is justification and also optimization. So the third question is, what are some of the common medical machines that produces high radiation exposure during the usage of that machine, and state the reason why? So basically, she answered CT scan because she specialized in that area. And typically, CT scan impart doses to organs that are 100 times higher than the doses imparted by other lower dose modalities such as chest x-rays. Because in CT scan, it has an increased exposure because they use a series of x-ray images. This means that a slightly higher risk of possible short-term and also long-term health effects that it will affect the patient. So for the next question, what are the steps taken to decrease the radiation exposure harmful effects towards the patient? So she basically answers customizing the scanning based on the size and weight of the patient or the body part being scanned, eliminating unnecessary exam, investing in high-dose machine with the latest hardware. She also stated that to decrease the radiation exposure, we need to keep the time of exposure to a minimum and wear appropriate clothing or place a shield between yourself and the source. So she also stated that the radiation protection practices HQEII, which actively involved in the quality assurance program from the Ministry of Health. So for the last question, how do you approach educating patients about the risks associated with radiation exposure? She basically said that we need to design a brochure or an infographic to educate patients about the radiation exposure that happen in the imaging industry. So we need to use the social media to our advantage to share this knowledge to the patient so we can together decrease the radiation exposure that happen in the imaging industry.
So, the conclusion for our task is the type and dosage of radiation that patients receive for medical purposes are important consideration. This is true because the type and dosage of radiation used in medical procedures are crucial factors that require careful consideration. Radiation therapy is a common medical treatment used to target and destroy cancer cells. Next one is safety rules, and modern technology also play crucial roles in lowering risks associated with the medical radiation exposure. This is because modern technology have advanced imaging techniques. For example, high-resolution imaging technologies enable precise targeting of tumors and accurate treatment planning. Last but not least, administering treatment at the right dose reduces risk. Administering treatment at the right dose is also a fundamental principle in medical care, particularly in the context of radiation therapy. Proper dose management is crucial for achieving the desired therapeutic effect while minimizing the risk of side effects and complications.